Hello, anybody home?
Hello.
Yes.
Bote, this is Janice. Can you hear me okay?
Can anyone hear me?
Yeah, Bote, can you hear me? This is China. Janice, can you hear me?
I can hear you, China. Can you hear me?
Yes, I can.
Woohoo! All right.
Thank God. I know.
I was freaking out too.
I know. I'm like, I got to get on here early to make sure they can hear me. I don't know if Mbote can hear us.
Hi, Janice, can you hear me?
Hi, Bote. I can hear you. I'm hoping you hear me.
Hi, Mbote. This is Paul Glady. Can you hear me?
Paul, can you hear me?
Yes, Mbote, can you hear me? Can you hear me? Hello?
Paul, I can hear you.
Oh, good. Thank you. Okay.
Hi, Paul. This is China. Can you hear me?
I can hear you, China. I can hear Mbote, and I heard somebody else's voice as well, too. So just making sure I'm working.
I don't think Mbote can hear us. I'm not sure. Did he
I
say
agree.
he can hear?
And Bote, I think there's an issue with your setup.
Yeah.
This is Ellie Doherty. Can you hear me?
Yes.
Hi, Ellie. We can
Ellie.
hear you.
Oh, good.
This is the world's worst Verizon commercial at this point right now, I think.
Yeah, pretty much.
It is.
Good afternoon. This is Chuck speaking.
Hello, Chuck.
Hi,
Hi.
Chuck.
All right. It said my microphone wasn't connected there for a minute. And I was like, oh, getting worried. I guess it's just the panel's on right now, right?
Yeah, I think Mbote's having some issues hearing. He can't hear us.
Oh, okay.
Yeah.
Yeah, I just practiced my slides a little bit before here, so let's see. Is Paul on? I can't.
I am here. You do not have to. You could do my slides too if you want to practice those.
Nah, you're such an expert and so good. I just, I'll never steal that. I can never replace those shoes.
I've been practicing these slides all day because usually Stacy does these slides for us, and anything else I probably know blindfolded, but I think this one's a new one for me. We shall see.
Yeah, it should be fine.
Yeah, no,
We'll get through it.
we just need to make sure. Is other people? I just want to make sure that the agencies are able to hear us or not, but just to make sure Mbote is able to.
Yeah, I don't think it's been started yet, so.
Oh, okay. So people can't. Okay.
Right.
And I'm assuming he's going to drive the slides then, correct?
Apparently. Yeah, right
Okay.
now we're just a closed audience.
Okay. Okay.
I can hear everyone. Okay. Janelle said she could hear everyone, so. I guess we're not.
Closed.
I guess we're closed. Okay. Oh,
Can hear you guys now, Paul and Janice.
Can you hear
Oh,
me?
thank
too,
you,
Mbote?
Mbote.
Yep, I can hear you guys now. Fine.
Wonderful.
Awesome.
We're glad
Hi.
for you.
Let me try and share my. If you guys can see my screen, please just confirm. Let's do this.
Yeah, we see
Okay.
the slide.
Awesome. I was gonna
all right, everyone. We'll be starting in about 2 minutes here, everybody. So we are live, and so
We'll have introductions shortly, a little bit after 1 o'clock.
So whoever is leading, when it's time to move to the next slide, please just indicate and say next slide, and I'll move it, please.
I'm on it, Mbote.
Sounds
Gotcha.
good.
Awesome. All right, just checking. Can you see this move? Let's see. You see it move?
It's not moving for me. I don't know about anybody else.
Not
No,
moving
I
for
didn't
me.
see
It's not
any
moving.
move.
Okay. That's
See the
what I thought.
title slide still.
So that's not this. That's not the screen. Then let me. All right. So it should work now.
You're out of presentation mode, but we can see you moving around.
Can you see the screen?
Yes.
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 You're just
It's
not in
moving.
presentation mode. Yep, you're moving.
Okay. Paul, you said I'm not in presentation mode.
That's
Not
correct.
for
We
me.
can see
Correct,
your
yes.
entire window.
Okay. So do I need to change it, or is that okay?
I think you have to put it more in slideshow mode.
Slideshow? Okay.
Mhm.
From the beginning, and then I'll change it
Yep.
now.
You're
Alright, let me-
showing,
Yeah.
now you're showing, yep, go ahead. I'm sorry.
Change that.
There you
Yeah.
go. You got it.
You're-
Well, okay, welcome everyone to the electronic visit verification public meeting this afternoon, July 30th. We're gonna wait and give it more minutes for more people to join, and then we'll get started on content. Thank you. Okay, it looks like we still have more people joining, so we'll give it another minute or so. Okay, I see that more people are joining, so I think I'm going to give it one more minute before we get started, but thank you for everyone's patience. Okay, it looks like the bulk of people who are trying to join were successfully able to enter the webinar. So we'll go ahead and get started. Good afternoon. My name is Janice Bickle. I work for the Office of Long-Term Living in the Bureau of Policy Development and Communications Management, and I will be kicking us off this afternoon. We are here for the electronic visit verification public meeting, and this is July 30th, 2021. Next slide, please. So as a reminder, all our phone lines are muted. Questions should be submitted through the chat feature. When you submit a question, please ensure that you reference the slide number so we know where to research to answer your question. We will not be providing answers for submitted questions during today's presentation, but questions will be addressed after the presentation through a listserv communication. Okay, next slide, please. Our agenda today is to go over home healthcare services EVV implementation, the new SanData EVV customer portal, an upcoming SanData alternate EVV town hall. We're gonna go over some general EVV personal care services reminders. We'll talk about DHS system implementation updates, and we'll review our EVV contacts. Next slide, please. Okay, I'm going to kick it over to Ellie.
Good afternoon, everyone. The 21st Century Cures Act mandated that states implement EVV for home health care services by January 1st, 2023. The department intends to similarly provide a soft launch period where home health care services EVV parastatus codes will be set in a pay and list disposition prior to January 1st, 2023. The department has updated the provider notification letter status. It will be mailed out. They'll be mailing a provider notification letter today and subsequent listserv communications identifying the required services and next steps to begin the implementation process. The department published a list of Medicaid state plan and waiver services identified as home health care services that are subject to EVV. The list is available on the DHS EVV webpage. Next slide. A separate EVV MA bulletin will be developed for home health care services. All claims and encounters for personal care services subjected to EVV requirements for dates of service on or after January 1st, 2021 must have a corresponding electronic visit or claims payment will be impacted.
Okay, thank you, Ellie. So here are our list of home healthcare services programs that are subjected to EVV. Within the Office of Medical Assistance Programs, we have children, program exception for pregnant women, adults, and physical health choices. Within the Office of Developmental Programs, we have the Adult Autism Waiver, the Community Living Waiver, the Consolidated Waiver, the Person Family Directed Support Waiver, and their base funded program. Within the Office of Long-Term Living, we have the OBRA Waiver, the Community Health Choices Program, and the Community Health Choices Waiver. For new home healthcare services alternate EVV integration, home healthcare services providers need to determine whether to use the DHS EVV solution or use their own alternate EVV system. The list of certified alternate EVV vendors for PCS is available at https://dhs.pa.gov/providers/billing info/pages/alternate EVV. And that's also searchable on the DHS webpage. Home healthcare services providers who also provide PCS should start working with their vendors in order to integrate for the home health implementation. In order to keep current on the EVV home healthcare services implementation, we have our webpage right here for EVV. And providers are strongly encouraged to request to be added to the EVV listserv by sending an email to ra-pwevvnotice@pa.gov and provide your provider name and email address, and that will get you added to the EVV listserv. Okay, Paul, it's your turn.
Thank you, Janice. I appreciate it. And hello, everyone. Happy Friday to you all. My name is Paul Gladdy, and I am the Customer Success Manager for SANdata to the Commonwealth of Pennsylvania. So anything that has to do with EVV in the Commonwealth of Pennsylvania and aggregating that data, I am the Customer Success Manager in charge and working with the Commonwealth. Today, what I'm going to do is I'm going to introduce you to the new SANdata Help Center. It is a portal that's going to allow you to access your support tickets as well as a SANdata Knowledge Center. And then after I get done describing and going through that in a little bit of detail, I'm going to talk a little bit about a alternate EVV town hall that we're going to be hosting coming up on August 20th, and I'll get to that after we go through those slides. So real quickly, the Help Center is something that we're rolling out. It's brand new. You still will be able to open up your support cases and support tickets in the same methods that you've always been able to, through emails or calling the 800 numbers, whether you're calling the PAC line for PAC assistance or for the alt EVV emails and phone numbers as well. However, this just gives you another additional avenue to be able to submit your support tickets, look for information, content, and helpful pieces of tidbits that you may not be able to access normally. So it gives you one place to go to try to access most of this information. And then you can also, most importantly, everyone always wants to know what is going on with my support ticket, and this is going to give you an insight into that, so that you don't have to feel as though that you have to reach out every 5 minutes, in an email asking what's an update on this ticket. So go ahead, next slide, please. So first, we're going to talk about the use of the Knowledge Center. Thank you. So a couple first things that I want to talk about. So many of you may have already received an email from SANdata regarding the new support portal. And it's also known as our Knowledge Center. If you have not, do not worry, we'll send out the information afterwards on how to be able to get your access to the support portal. You notice the terminology that we use sometimes is Zendesk. Zendesk is actually the system that we use to track all of our support tickets. So if you ever hear the word Zendesk, that just means it's the system that we use to track all the support cases and support tickets. As a note, before I begin, again, these are all helpful access points for those people that are using alt EVV. They're vendors as well. So if your vendor would like to sign up for the portal, your vendor is more than welcome to do so. And in addition, anybody in your agency that would be opening up any support tickets or would like to monitor any of these support tickets. Okay, so it is a very we're trying to include everybody, not just the agencies, but the vendors as well too, so that everyone can have access to the information that's contained within the Knowledge Center. The one little quick note that I do want to point out is that if you are working with OMAP Physical Health or the CHC MCOs, you still need to use the avenue of your vendor that's aggregating that data. So if you're working with CHC data, you still would need to reach out to HHA Exchange first before you would open a ticket with the SANdata system. And then the same thing with the OMAP physical health MCO visits as well too. Nothing really changes in the process of things. This is just going to give you an avenue of be able to see more data, more information, and more transparency into your tickets more easily. So real quickly, if you've ever used or submitted a ticket, your information is going to be in the Zendesk system associated to you. And you can get you'll get a password when you log in for the first time, and we'll show you about that in just a moment here. If you've never submitted a ticket, then you'll have to go in and log in for the first time, and obviously, enter your information so that we can have you in the system to be able to associate you to an organization. So you will not be associated to an organization, and we need to do that when you log in for the first time. Users can contact the customer care team to assist with, logging into the portal. So if you are having difficulties, you are not sure how to get into the portal, all of our customer care attendants are trained on the portal and can assist you on getting logged in and getting up and running if you have some difficulty. But it should be pretty self-explanatory, and to be able to log in for the first time and be able to navigate through the system. So to again, and the last thing is this is basically to reach out to customer care team more quickly. You're not going to see any more content or any less content than you normally see, but it is a way to be able to access that information more readily, more quickly. Next slide, please. So when you go to the slide, you're going to log, or you go to the Zendesk portal, you're going to log into sandata.zendesk.com. That's going to be the landing page, and you're going to see this page right here. Apologies, you'll see in the middle there's a green box there that has a video. We're re-recording that video, so when you log in, if you do that today, you won't see the video, but we are putting the video back in. So if you have any questions about instructions, there is an instructional video right there in the middle for you. You'll see up at the top how to contact us, how to sign in, and you'll see that little box in the middle, which is very important because we allow you to type questions in without even signing in to try to find some information, and it'll populate information as you start to type in, common themes. So if you want to look for an addendum or alt EVV information, it will start populating information for you. Next slide, please. So when you first logged in, you're going to see at the very top, you'll see a new ticket, my existing tickets. You'll see that box in the middle again, and then you're going to see several boxes at the bottom, alt EVV, this getting started, the New York EVV training. That's there for everyone. So, and we have a note on the next slide that is there for all providers, agencies. We're not going to remove that, so just disregard that because obviously that's not anything that's going to be relative to the Pennsylvania program. And then there's the Sandata ID&D, and then there's training information. So there's right at your fingertips, there's access points to a lot of different content. And I do, again, want to give a quick disclaimer. We're still getting all the content updated into the Knowledge Center. So if you don't find anything today, hopefully next week or the following week, we'll have everything up there and ready for you at your fingertips. Next slide, please. And I have a lot of slides, so I apologize if I speak too quickly. Please slow me down. Again, as I mentioned on the previous slide, the New York training slide, this module doesn't apply to Pennsylvania. So, please disregard that. The alt EVV or the alternate EVV documentation icon, that's where you're going to be able to find a lot of your documentation that you need for the state programs that are used for the alternate EVV interfaces. Again, it's a quick and easy way to find the information. I do want to make sure that everyone is aware that the default page for all the alternate EVV information is the Pennsylvania website. So while we keep everything up to date, Pennsylvania website is the page of truth. So again, you can go to our website and you can go to the Pennsylvania website, but please default to the Pennsylvania website if you have any questions whether or not an addendum is accurate or not. But again, it should all match up. And then, of course, anything that has to do with getting started and helping using the Sandata EVV ticketing center. So if you have questions and you want to learn a little bit more about how to use the ticketing center, you can click on that icon there. So a lot of self-help topics here for you to start off with. Next slide, please. So when you log in, again, you're going to see product user guides as well too. That's for the SANdata EVV, as well as anybody that's using the DHS aggregator. Again, remember that those are two different systems. The DHS SANdata EVV is a separate system from the DHS aggregator. So again, I just want to make note of that there's product user guides, quick reference guides, and then of course release notes. I know everybody gets those emails. They probably filter them into a folder, don't read them, may delete them, but if you ever want to go back and look at them because you may have deleted an email, you can click on the release notes and you'll see those in there. And then of course the training information, LMS websites, webinar registrations, and then of course any recorded webinars, because we do have a recorded webinar library now as well too, where you can go to look at little snippets that are several minutes long to a couple hours long, but most of the videos are very short snippets to help you navigate through different modules of the aggregator or the SANdata system. Next slide, please. Thank you. So going into the Knowledge Center, I like this, this feature, as I mentioned before, the search bar, to look for content. If you have something that you're looking for and you can't remember what one of those icons you need to find it in, you can type it in to the search bar, like how do I reset my password, or maybe how do I run a report, and it will either tell you how to do that, or it'll take you to the guide or documentation that will provide that information to you. So you may not even have to, log a ticket for some of these things or go into a video. You may be able to find that information by just typing into the search bar, just like you do with Google, and find it by, entering all that information in your question. If you don't, and you click through and you can't find it, then, the next steps may be to open up a ticket if you need some help with anything. But there's going to be boxes that'll pop open. It'll give you some suggestions. It may give you one, it may give you multiple. And as you can see in the lower box there, the person's typed in, how do I reset my password? And it came up with about 4 different types of content. And you can click on either one of the items that you feel is going to help you out and take a look at and see if this is the item that you need. Next slide, please. So moving on in the Knowledge Center, we haven't even gotten to the support portal yet, so we're still in the Knowledge Center. When the users click on the articles, the article links from their search, the full article is going to open up for you to review, and then you can also decide whether or not you want to download that later on. So you can review the article and then determine whether or not it's what you need and download it. Other articles in the section of the help manual also appear along with the on the left side of the page. And any user that's using this can work with this article or go back to their search and look for additional information. So I recommend for everyone to take a moment, go in, and again, because this is so new, look around, see what's in there, and just see how you can use it to your fullest advantage. And I'm going to stop there, and we're going to move on from the Knowledge Center, and we're going to move on into the ticket portal. So the ticket portal is essentially, it's going to be give you an ability to review all your submitted tickets, update any existing tickets, and submit any new ticket requests. And I just want to make something clear. So if you sign up for the portal today, any ticket that you have opened in the past, you'll be able to see those open tickets right now. So you don't have to go in and open up new tickets to be able to see those tickets. Anything that you do have open or pending right now, you'll be able to see in the portal the moment that you do log in and register into the new portal system. So don't feel as though you have to go in and reopen all your tickets up again. So, but again, you'll be able to, go in, you'll click on the new ticket box, and it'll give you this little box. Again, there's a lot of search boxes that it will ask you to select the most appropriate form for, from this list. At this point right now, we only have 2 choices. So you're always going to choose the general support selection here. Next slide. Thank you. So when you go into the ticket, it's going to give you about 6 different or 6 different items that we need you to fill out to help us. Obviously, the more information you provide us with any ticket is, very helpful. Obviously, a subject, a brief explanation of what your issue is, phone number. While it does say optional, we do ask you to include the phone number. While you may think that we have your phone number, we definitely sometimes need to have your number to reach out to you. So even though it says optional, I highly recommend adding that in there so that it's easier for our team to be able to reach out to you if needed and easier. And then a description, details about the issues, examples, the troubleshooting tasks, information to help with the agent. And again, in that description, if it's about claims, we also would like to have the information of, the program office that you spoke to, whom at the program office you spoke to, so that if we have to go back and, get some help with the program office, we know who you spoke with at the program office. And then, of course, any attachments. So you can go in there. You'll see at the very bottom in the square or the rectangle that you can put attachments in there. I'm going to warn you right now that the attachments is not a secure system. So please make sure that you secure your documents using an encryption device of some sort to secure your attachments in there. So again, I want to reiterate that the attachments are not through a secure server because they're coming from your computer to another system. We want to make sure that you always encrypt your PHI data before you attach it into the support portal, okay? Because that's very important. And then click submit for the ticket, and that's going to generate the Zendesk ticket, and it assigns it to the Tier 1 team for the user state pair program. And I'm not going to go into the weeds. Those of you that are too much into the weeds, but those of you that are calling into the PAC line, you still will go through to the PAC line. You can still call them and ask them for support for the DHS SAN-Data EVV. If the DHS and the PAC team opens up a ticket for you in the portal, you will also be able to see that ticket in the portal as well too. So again, the Tier 1 team may be assigned the ticket. You can call the PAC line. They can open up a ticket, and you'll still be able to see that ticket inside of the support portal as well too, because your name is going to be associated with that ticket. Okay, next slide, please. Sorry, a lot of content here. So when you enter your request or your requested subject, the system's also going to generate some articles and some items as well too when you're starting to put that subject line in there, and it may give you helpful pieces of advice that you realize, oh wait, there's an article about this. I don't even have to open up a ticket, and I can read this article. If none of these are related to you, just ignore them and move on, and you can just click past it and submit the ticket without even paying attention to any of those things. So just keep typing it. It's not going to overwrite anything for you. You just type the ticket in or type your subject in and keep going, and just ignore what it's populating if none of it is relative to what you're submitting. Thank you. Go ahead. Next slide. So when you go in and you get into the portal itself, you're going to see a list of tickets that looks like this box right here. These are obviously test tickets that are in here, and you're going to see the subject, the ticket number, those numbers, the 192, 114s, and so on. Those are the ticket numbers. Those are always important to have, because if you want to reference something, especially if you're working with the program offices, or you are looking to escalate something because you need some assistance, those ticket numbers are very important. The person that requested the ticket, as well as, of course, when you created and opened that ticket. And then, of course, the last activity. So you can see if anybody's been working on the ticket or not, when was the last activity, and then the status of the ticket. In this example, all these tickets are solved, but if this ticket, any of these tickets were open, it would be in red, and it would show a red open box there by the status. Or if it was waiting for a response from you, it would be a screen pending, and it's pending a response from the agency. So if you see green, that means we're looking for a response and we need some information from you. If you see red, that means it's in our court. And then, of course, if it's on hold for some sort of development, you'll see that as well in here too. So, but you can go in, you can search all your tickets, you can look at any of the unsolved tickets, and you can look at any solved tickets up to about 90 days old. In addition, you'll notice at the top there, you see my requests. You'll also see that the requests that I'm CC'd in. So if somebody in your agency opened up a ticket and CC'd you in the request, you're going to be able to see those tickets as well too by clicking on the next icon over, which is requests that I'm CC'd on. So let's go to the next slide, please. So again, users can view all the tickets that they've been CC'd on. That includes if you were to include any of the program offices. If the program offices were included on their in your CC, they'll be able to monitor those tickets as well too in their requests I'm CC'd on. So you can go in and you can take a look at all of those tickets in the same manner as the ones that you've requested as the ones that you're CC'd on too. So similar concept, but again, you didn't open up these tickets. In addition, one thing I did forget to mention is you can close tickets that are your tickets. The ones that are you're CC'd on, you cannot close those tickets. So moving on, so when you're in the ticket, you're going to see a lot of different information in there. You know, all the public comments are visible to the users. You're going to see the details, including information, you know, submitted on the web form, you know, on that ticket. And then of course, you're able to solve that ticket, as I mentioned a moment ago. So if you happen to open up a ticket and you realize, you know what, I just figured it out, I know what I did wrong, or, you know, the issue is not a problem anymore, we can solve this. You can go in and actually click the ticket to solve it, and then our team will not, you know, have to work that ticket any longer. So the moment you solve it, you know, we then know that it's something that we don't have to work on. However, just a quick note on that, if you solve it and then maybe 3 days later you say, oh wait, I need to reopen that ticket again, you have up to 10 business days to open up a solved ticket again. If not, then it goes into a closed status. So if it says solved, you can still reopen that ticket again and, you know, and write into that ticket as well. So solved doesn't mean that it's the end of that ticket. It just means that in about 10 days, it's going to go into a closed status. Okay, next slide, please. So any tickets that you need to update, there'll be an add to conversation. And again, that you'll see the red box over to the right-hand side of the arrow that says it's open. We're not waiting for a response, but you want to know what's going on. Hey, this ticket's been open. I want to get an update on this ticket. So you type in there, you know, can someone please provide me an update for this ticket? Type it in there. You click send, and that will be in there, and you'll be able to see your response as well. And when you've clicked in, I would like to get an update on that. And then, of course, as I mentioned before, people that were CC'd in your ticket, if they go into their portal and they click on the CC tickets, they'll be able to see that you updated the tickets, and we're looking for an update on the on that ticket, or a status update on that ticket. Next slide, please. And the last slide about the updating the tickets is just, you know, again, how to use the field. And I'm sorry, but if you can slide back to the first, the last slide really quickly, just so I can show you. You notice how the box is very slow there by the, or very small by the arrow. And you slide, if you can slide back now to the next slide again, please. Or move back. I'm sorry, yep, go forward. Sorry, forward two. There we go, thank you. And you'll notice now the box is bigger. If you look in the very right-hand corner, there's that those little lines that are diagonal there. You can open these boxes up. So if the box is a little bit too small for you to type in, you can drag that box open so it's a little bit bigger, and you can see what you've typed and what types of things before you hit the submit button. So again, just a handy little tip here that you can expand your the box so that you can see a little bit more about what you've typed in the field there. And once you're done, you submit the ticket, and that's it. That's all there is to it. So that's the new Knowledge Center and the portal. As I mentioned, we will send out, we've already sent out one email to everyone. If you did not get the email about the Zendesk support portal, you can actually go to the link that's in the slides that we showed at the very front of these slides and go ahead and log in, or we will be sending out another document to remind you about the portal later on. And again, this is for the agencies, the agency administrators, and of course your vendors as well too. So we want to make sure that everybody has access to providing tickets. So the next thing I want to talk about is in the last couple of minutes here is the SANDATA Alt EVV Town Hall. And the Town Hall, basically what this is this is something that we're doing to basically help with a lot of the common problems and frequently asked questions that we're getting throughout the alternate EVV world. You know, we're working with over 70 different vendors in the Commonwealth. We have about 1,800 different agencies that are sending data using an alternate EVV system. So as you can imagine, we're seeing a lot of questions and a lot of common questions, but also some that, you know, pop up every once in a while that, you know, people are just, you know, looking to get the answers to. So we're going to have this town hall. It's open to everybody in the Commonwealth that's using an alternate EVV system, as well as their vendors are invited. And any technical representation that you have from your agency, again, is able to attend. The session is Friday, August 20th from 11 a.m. till noon. Pre-enrollment is required. And I apologize, Janice, I loved how you went through the links. I'm not going to go through the whole link and go through the SANDATA Zoom link for you all, but the link is in the slides and we'll send, you know, that'll be sent out after the meeting as well too. But please, you know, go to the link, pre-enroll. It's August 20th. It's only an hour long. We will be, you know, fielding questions through chat as well too, and answering them there in the chat. Somebody will be monitoring those, so please take the time. Again, it's only an hour long period of time, but we're going to try to answer a lot of the, you know, frequently asked questions so that we can help, you know, alleviate some of the confusion that may be out there for some of the Alt EVV agencies and vendors. And just real quickly, a run through of the topics again. Is, you know, again, you know, what is Alt EVV with SANDATA? Again, that's just anybody that's using a SANDATA system or a system other than the SANDATA. We'll run through the integration process. Well, most everybody's already integrated with the aggregator. We'll just quickly make sure everybody is up to date on knowing what the specs and the addendums are. There's a difference between the core specs and then the addendum. So again, we'll talk about what's the difference between each of those and who should be, you know, who should have those and who shouldn't have those, or who doesn't need to have those. Understanding of the certification process. Once again, most everybody that's probably on this call may already be certified, or their vendor may already be certified and tested and sending production credential or production data at this point right now, but we'll briefly touch that. And then most of the conversation will be around the common errors and then troubleshooting steps. You know, this, you know, what happens when this occurs, what happens when this occurs, and, you know, who should be monitoring, you know, what types of things and what should you be looking out for. And if I see you know, this error, what, you know, what are the steps that I should follow to be able to resolve this issue? So again, vendor agency resources, anybody that's anything to do with integration, any agency resources, again, are welcome for this town hall. And that's my, we have questions in here. So if you want to write into the, any questions about the portal, please feel free to ask them, and I will answer them after they send them over to me. Thank you.
Thank you very much, Paul. We appreciate you sharing all that information with us. So now we're going to move on to some general EVV personal care services reminders. So for our personal care services EVV implementation, EVV compliance requirements for personal care services were implemented on January 1st, 2021. All claims encounters for personal care services subjected to EVV requirements for dates of service on or after January 1st of 2021 must have a corresponding electronic visit or claims payment will be impacted. We also have a bulletin entitled Electronic Visit Verification for Personal Care Services, and the bulletin number is 07-20-04, 54-20-04, 59-20-04, 00-20-03, and electronic visit verification for personal care services provided in fee-for-service delivery system. That bulletin number is 05-20-03. And there's a link in order to access that. Okay, next slide. And I'm going to throw it over to China. Thank you.
Good afternoon. My name is China Jackson. I'm from OMAP Bureau Fee for Service. I work in the Division of Operations. I just wanted to provide you with OMAP Fee for Service resources, Medical Assistance Bulletin 05-20-03 titled Electronic Visit Verification for Personal Care Services provided in the fee-for-service delivery system may be viewed at the following link below. More information can be found on the department's EVV webpage at the following link below. Next, please. Next page. Next slide.
All right. Hi, folks. I'm Chuck Frick from ODP. If you're a new provider, you'll be wanting to pay attention to these next couple of slides. Questions we get a lot is new providers are all excited. They made it through an orientation and they got in the promise, they're ready to provide services. Well, if you're providing you're providing personal care services, then you need to do some EVV training first. So if you're going to be using the Sandata EVV training, you'll need to go to this web link here. If you're going to be using an alternate EVV system user training, then you will need to go to the next link that says for all EVV providers. So again, DHS EVV technical vendor Sandata will issue login credentials to access the DHS Sandata EVV system or the EVV aggregator once a provider completes the mandatory training. Next slide. So here's if you're a new provider, you're going in, you click on that link. This is kind of the screen you're going to see. But if you're already existing provider, you use LMS for DHS data EVV, then you may need to clear your cache and then to be able to use the link for the EV aggregator trainer. One of the things is that as a new provider, that if you're excited, ready to go, you want to complete this training, you want to go ahead and get a jump started, but you're not enrolled yet. Well, you cannot do it until you have your Medicaid provider ID. So that's one of the things that you have to go through the promise enrollment system, get your Medicaid ID first, and then you can do the training. Next slide, please. And again, it's just the key that you'll be getting after you select a login. Here you see what it's going to look like, and as you go forward into the training platform. Next slide, please. Okay. Providers electing to use the Department of Human Services Sandata EV system. Again, providers using the Sandata system EVV must complete Sandata self-paced training in order to receive credentials to use the system for OPRA, Act 150, the Office of Developmental Programs, and the Medical System Programs fee-for-service participants. Upon completing the self-paced training, providers will be issued a time-sensitive welcome kit. Make sure you take note of that, including their agency's production credentials. Providers must set up their agency and direct care workers in the EV provider portal and train the rest of their staff on how to use the system. So that's a very important concept there that folks need to be understanding. It's not that you're just getting trained in SANdata, but again, you have to train all your staff members and get them to use the SANdata mobile app or the telephonic visit verification to capture the modalities of the direct care workers. So again, it's just very important that, you know, it's a big training component for a new provider. Again, you got through promise, you're already provide services, and now you have to do this EVV and set up EVV and make sure all your staff and managers are trained to your agency's policies and procedures. All right, next slide, please. So again, alternate EVV credentials are required for any provider using an EVV system that is not a DHS SANdata EVV or HHA exchange. The testing credentials process is 8 steps. Again, you have to complete all 8 steps in order, and it's a collaborated effort between SANdata, the provider, and the provider's own EVV vendor. Providers and the provider's alternate EVV vendor are not considered certified until all 8 steps are completed. So again, there's a quick reference guide and on a DHS website, and it goes detail by detail of these 8 steps. Just one thing to note is after you complete your 8 steps, you will be getting you'll be getting an email, and your agency is not considered complete until your agency has received the completion email. So that's going to be like your golden ticket to move forward. Okay. All right, Janice, I'm going to go back to you.
All right, thank you, Chuck. Now we're going to talk about DHS provider communication. So the Department of Human Services is looking to perform some targeted outreach in order to provide technical assistance to providers that either have not submitted any EVV data or have a high percentage of manual visits. That communication is just to assist them with issues. There are no penalties that we're looking for. It's just to provide that technical assistance. As a reminder, providers should self-monitor their EVV compliance at this time and work to improve any areas of non-compliance. DHS is not currently pursuing any monetary sanctions for EVV compliance. An aggregator account cleanup activity, some things that DHS is working on. We are currently assessing multiple unused accounts and we'll be communicating a decommissioning strategy for those. Okay. As a reminder, SANdata has an EVV video library. The SANdata video training library of informational videos may be found at the link on this slide. As a note, the video library content covers SANdata core functionality and it is not specific to Pennsylvania DHS's configuration. The training library does not replace the SANdata learning management system for users with DHS SANdata EVV system credentials. And it is available to help providers train their employees and provide caregivers an educational tool for the SANdata EVV system. Library content covers an introduction to EVV, how to use telephonic visit verification, and how to use report functions with SANdata Mobile Connect. I'm sorry. Okay.
DHS system implementation updates. So DHS program offices have been monitoring the status of personal care service claims for their providers. All data you're seeing here is displayed from July 2021 as of reports pulled on July 25th. So what you're viewing here is an illustration of all of the claims received for personal care services split down by program office and then the percentage of those claims that set one of these respective error status codes related to EVV. For instance, you have OLTL, 80% of the incoming claims set edit 925, which is the claim was able to find a verified visit within the DHS aggregator. 8% for OLTL set 927. That's just meaning that the claims received on the units received on the incoming claim was not able to match those units as tallied up from the DHS aggregator verified visits. And finally, 11% of the claims found no match. Across ODP, you had 90% verified visits, a little over 3% not matching on units, and 6.5% were not able to find a match. Finally, for OMAP, you had 61% that were able to find a visit, and then 23% not matching on units, and 15.5% not finding a visit. So the program offices will continue to monitor these percentages with the hope that they'll continue to increase as additional visits are verified and submitted to SANDATA into the DHS aggregator.
All right. So for ODP, you taking some of that data that they had in the previous slide, you can see our timeline over, from April, since April 19th, promise found matching EVV visits records for over 90% of ODP personal care services, details processed. So as you see, we're doing fairly well. But we always have room for improvement. And again, just under 3.5% of ODP personal care services details set with the error status code of 927, indicating the units billed are greater than the number of verified units in the DHS aggregator. And nearly 6.4% of ODP personal care services details set at error status code 928. So that means no matching EV visits verified, visits found at the time of the claim processing. So ODP is doing fairly well. We're doing good. You have a little drop down there in July, but maybe that's because of the new fiscal year renewal process, but hopefully that'll get back up. Next slide.
Okay, thank you, Chuck. For the Office of Long-Term Living, our OLTL fee-for-service personal care providers who are billing Medicaid through Promise had over 80% of claims service details processed find a corresponding EVV visit record between April 19th and July 25th. So 7.9% of OLTL fee-for-service personal care services, sorry about that, claims service details set ESC 927, meaning an insufficient number of verified units were found in the DHS EVV aggregator during claims processing. And 11.6% of OLTL fee-for-service personal care services claims service details set ESC 928, meaning there are no matching EVV verified visits found at the times of claims processing and Promise. Next slide.
So I was just going to provide you with the stats for OMAP fee-for-service providers billing Medicaid through April 19th, through July 25th. Medicaid had 52% of services details processed finding matching EVV visit records. 15.5% of OMAP fee-for-service PCS details denied on ESC's 927, for the number of units billed being greater than the number of verified units found in the DHS EVV aggregator during the claim processing. 32% of the claims for fee-for-service PCS details were denied on ESC's 928 for no matching EVV visits found during the claim processing. Fee-for-service is continuing to see a positive upward trend. Next slide, please.
Frequent visit exceptions. So this is an illustration pulled from a reporting tool of the last 31 days of those claims setting a visit exception. Over the last month, we've observed, as you see here, over 80,000 visits setting a visit exception. And then this chart illustrates the number of visits setting per visit exception type. We'd like to remind the listeners that visitors setting visit exceptions will require either a manual fix or acknowledgement to resolve in the DHS EVV system. Visits that require manual fixes will count towards the quarterly manual threshold. So if a visit exception sets and is unresolved, the visit cannot be found during claims validation, the claims processing. Unresolved visit exceptions are not considered verified visits, and the claim service detail will then set ESC 927 or ESC 928, meaning the visit's not found. So next slide, please. So as shown, this information, this list of visit exceptions are what you saw in the graphical key on the prior slide. These are the agreed upon exceptions between SANDATA and DHS program offices. So what you have here on the bottom of this slide is the contact information. If you're reviewing your exceptions and you see visit exceptions other than what's listed here, you're going to want to reach out to these parties to help resolve those inconsistencies. Next slide.
Alternate EVV fee for, oh, is it? I'm sorry, whose turn is it?
This is Ellie. Sorry about
I'm
that.
sorry,
I
Ellie,
was
go
muted.
ahead.
Alternate EVV for fee for service addendum to be updated. The new employee identifier format to be supported for fee for service in addition to existing formats. PA DHS strongly recommends supporting the new format to avoid duplicate employee ID errors. Pennsylvania DHS will be releasing an upcoming listserv requesting comments on the PHMCO rounding rule options. Next slide, please. Next slide, please. Thank you. Any provider using DHS SANDATA EVV will receive notice when billing is live and functional. When billing is live, providers will be directed to take the recommended scheduling and billing training in the DHS SANDATA LMS system. The Commonwealth has completed testing activities and is currently working with its vendors on scheduling a production deployment date for the billing submodule. Next slide, please. The conditions to use criteria. Provider must use the DHS EVV solution. Provider must opt to use the scheduling module. Provider must have either an active BES account or a billing software capable of accepting 837 files from an external source or submit paper claims. For agency with choice providers, services are only billable under the lowest active service location. Please note that some data fields may need to be manually entered by the provider, for example, recipient birth date.
Claims verification steps is error status codes, ESCs, are actively setting for all claims with services subject to EVV that are submitted through promise for fee-for-service programs. Providers should be actively reviewing these ESCs to determine if their claims and EVV data are matching appropriately. The ESC guide published on the DHS EVV website outlines when claims would deny due to ESC 927 or ESC 928. Next slide. For billing issues such as why EVV ESCs are setting, what the EVV ESCs mean, questions about what is in the aggregator, please contact the following program offices claims. You have ODP claims resolution section. There's the phone number and a resource account, OLTL's provider call center, and OMAT provider inquire line. There's a call center. Slides 29 through 48 from April 28th, 2021's public meeting covered PCS, EVV, ESC claims resolution steps in detail. These are available for review on the DHS EVV website under EVV public meeting information. Next slide.
Okay, now we will talk about EVV contacts. If there are technical issues such as DHS SANDATA account assistance needed, welcome kit reissuance, you're locked out of your account for either DHS SANDATA EVV or an all EVV, I'm sorry, not for all EVV, just for DHS SANDATA EVV. You can contact the Provider Assistance Center. There's an email address and an 800 number. If there are issues related to alternate EVV, such as account unlock issues for the DHS aggregator portal, integration status inquiries, or issues with the DHS aggregator accepting file submissions, you can contact the Alt EVV support team for SANDATA at the email address in the middle there. And then there is an 855 number to call them. If there are issues related to HHA Exchange and CHC billing, please contact HHA Exchange at their support RA box and or the appropriate Community Health Choices Managed Care Organization. Vendors needing to integrate with the CHC MCO HHA Exchange should contact PA integration at hhaexchange.com. For any issues related to physical health MCO claims and billing questions, please contact your appropriate physical health MCO. Next slide. For general EVV program issues or requests to be added to the EVV listserv, please contact our DHS EVV resource account at ra-pwevvnotice@pa.gov. Providers with technical issues, reaching out to the PAC or SANDATA alternate EVV team should also contact DHS on those emails at the following email address: ra-pwevvissues@pa.gov. And providers with support ticket numbers they wish to escalate with DHS should reach out to DHS at the following email address: ra-pwevvissues@pa.gov. Okay, next slide. Contacting EVV support. If a provider agency does not have a secured email server or encrypted email, agencies should notify the mailbox that they do not have secured or encrypted email so that the mailbox can submit a secured email to that agency inquirer to respond to providing the relevant PHI or PII content. Alternate EVV vendors may not understand your agency processes, so please be as detailed and descriptive as possible so that the support teams can understand your issue to the best of their ability, and screenshots are always helpful. If you do have specific examples or screenshots, always send them via secured or encrypted email due to PHI or PII. If a provider is working with an alternate EVV vendor and has a ticket number, please provide the ticket number. That is very important. Always check your spam folders regularly for emails from PADHS, SANDATA, HHA Exchange, or other approved listservs, programs, and agencies. Next slide. Okay. As a note, Pennsylvania DHS has over 2,500 provider agencies. When opening a support ticket with one of the vendors, please remember the agents do not know how your specific agency may operate. So in order to assist them to assist you, please provide as much detail as possible when you open a support ticket. For example, what your specific request is, such as my employee provided services on whatever date they provided services on, and I do not see the visit in the DHS aggregator. Can you help me locate the visit? So the more information you provide up front, the quicker they will be able to assist you. Ticket submission requests due to technical errors, technical difficulties arising in the DHS SANDATA EVV system or DHS aggregator must have sufficient evidence for tickets to be created and resolved efficiently. Please supply the following to the appropriate mailbox based upon your issue as determined on the following slides. The specific issue with details, a quality image of the error or a screenshot, and additional details. Steps taken to receive the error, complete contact information, including your provider name, your Medicaid ID or provider ID, STX number, a contact name, email, and direct phone number. Next slide. And that is all we have for EVV contact information. So as a reminder, we're not taking questions live in this session, but we will remain open in the chat for you to submit your questions through the chat feature. Please make sure you reference the slide number in your questions. And we certainly encourage you to download the copy PDF of today's presentation because there's tons of links and email addresses and lots of good information for you to use in them. So thank you everyone for participating with us today, and we hope you have a great afternoon and a great weekend. Thank you very much.